On the Health Watch tonight, parents often joke that their children are addicted to their phones, but now there's science to show we all can get hooked on social media. Dr. Malika Marshall is here tonight.
And researchers found this connection, Malika, between heavy social media use and behaviors that are often associated with drug addiction.
I know, it can be really serious. So in this study, it was researchers at Michigan State University that surveyed more than 70 people, and they sort of assessed their psychological dependence on Facebook. And then they had them sort of do this gambling exercise, which measured their decision making. So for example, if they made bad decisions, they failed to learn from their mistakes, they continued down a negative path, and so they actually found that those who were worse at the gambling task tended to have the most excessive or the highest use of social media, whereas those who had the best scores on the gambling task or good decision making relied less heavily on social media. And they've seen similar patterns among people who have addiction to drugs like opioids and cocaine. So they're saying, you know, this is one step closer to trying to figure out whether we should identify excessive social media use as being an addiction, whether it should be labeled.
There's just no question when you see people walking around, some people are just on it all the time.
All the time. And like addictions, you hear people say, I had to completely get off. I just had to totally go cold.
Withdraw. Exactly.
Well, anyone who's ever been to an emergency room knows you can have crazy wait times, of course, especially now during cold and flu season. But there's a new study that found instead of seeking the care of an ER doctor or nurse, pharmacists could help. What do you think about this, doctor?
I think we underutilize pharmacists. I mean, here in this country, we sort of turn to pharmacists as being the experts when it comes to medications, but their roles are relatively limited. But in some parts of Canada, they've actually expanded their roles. So some pharmacists can prescribe certain medications, they can refill medications. In some cases, they can administer injections. And they found that up to a third of ailments, non-urgent ailments that are seen in the emergency room might be addressed by a pharmacist, like simple skin ailments or coughs, cold symptoms. So they're saying if we could strategically place some of these pharmacists who have these expanded roles in ERs and in the community, that it might be able to reduce the burden of the emergency room.
Makes sense. They see everybody come in, right?
Would it require extra testing, though?
Well, it might require some additional training, but, you know, I call pharmacists a lot. I use them a lot. Like, what am I supposed to do with this drug, or how often should I dose it? And it would be nice if they could have an expanded role.
They're often right there on the front lines.
They sure are.
Doctor, thank you so much.